Lacey, my name is Heidi. I'm a nurse practitioner student. Today I'm going to be doing a head to toe assessment on you. I'm going to be asking you some questions and asking you to follow some commands. And if there's any pain or discomfort at all, please let me know. The first thing I'm going to do is give you 3 words, and I'm going to ask if you remember them towards the end of the assessment. And they are 3, green, and dog. Okay? So first I'm just going to look at your arms and assess your skin on your arms. And turn them over. Good. And then I'm going to assess your capillary refill. Perfect. All right, next I'm going to assess your head, your scalp, and your hair. Good. All right. All right, I'm going to ask you to raise your eyebrows, close your eyes tight, wrinkle your forehead, frown, smile with teeth, puff your cheeks out. Good. So next I'm going to be using a cotton ball. I'm going to ask you to close your eyes and just say yes when you can feel it.
Yes, 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 yes.
Good. All right, next I'm just going to touch your face a little bit, okay? Check your sinuses. All right. Can you clench your jaw? Open your mouth. Close your mouth. Open your mouth. Close your mouth. All right. I'm going to check your artery. All right. Next, I'm going to feel for your lymph nodes: preauricular, postauricular, tonsillar, submandibular, submental, occipital, cervical, supraclavicular. Next, I'm just going to look at your neck and your neck veins. Good. And then I'm going to listen to your carotid arteries. I'm going to ask that you just take a big breath in and hold it. All right, go ahead. All right, let it go. And next. Good, let it go. All right, next I'm going to come around you. I'm going to assess your thyroid. Okay, and look to the right. And look to the left. Good. And go ahead and swallow. Perfect. And push up on my arms. Good. Okay, next I'm going to be doing an eye exam. I'm going to check the orbits of your eye, the sclera, and the conjunctiva. Good. Then I would be using a Rosenbaum chart. We don't have it for this video. Then I'm going to be looking in your eyes with my pen light. Just keep looking at my notes. 2, 1, 2. Good. All right, now I'm going to ask you to follow my finger. Good. 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 Next, I'm going to be putting my fingers behind you, and I want you to tell me when to stop when you see them, okay?
Stop.
All right, and then I'm going to move my hands. You tell me how many fingers I'm holding up.
2, 1, 2, 1, 2, 1.
Good. Okay, next I'm going to be assessing your ears and using my otoscope to be looking into your ear. I don't have one right now, so I'll use my pen light, and I'll be looking at the ear canal and the tympanic membrane. And repeat it on this side. Good. All right, I would like you to repeat what I say.
1, 2, 3. A, B, C.
Good. Next, I will be performing the Weber test and the Ryan test with a tuning fork. The Weber test I place on the top of your head, and you will just tell me if you can hear it equally on both sides. The Ryan test, I would place the tuning fork behind your ear on a bony prominence, and you would tell me when it stops ringing, and if you can hear it when I place it in front of your ear. Okay. Next, I'll look at your nose, making sure that it's symmetric. And I will look in your nose. Good. And next, I'll have you open your mouth. Move your tongue side to side. Stick your tongue out. Move it side to side, up and down, and say ah. Good. Okay, for the next part, we are going to be assessing your lungs. So I'm going to either ask you to lift your shirt up if you feel comfortable, or you can take it off and put it around your neck. So whatever one you feel comfortable doing. Okay. So I'm just going to feel your chest. Just breathe normally. And I'm just going to ask for you to turn around. Okay. Breathe normally again. All right. Now take a deep breath in. Good. All right, now I'm going to be doing a little bit of patting on your back, okay? Okay. Next, I'm going to be, actually, can you just say 99 for me?
99,
Again?
99,
Again?
99,
Again?
99,
And
99.
okay, next I'm just going to be listening to your back. So every time you feel my stethoscope, please take a big breath in, okay? Okay, go ahead. Okay, good. So next, every time I put my stethoscope on your back, I'm going to ask you to say E.
E, 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 E.
Okay, next I'm going to have you say 99, same thing.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and next I'm going to have you do the same thing, but whisper 1, 2, 3. Okay, good. Okay, and next I'm going to give your sides a little pat, okay? Any of that hurt? All right, and now I'm going to ask you to turn back around front, and I'm going to listen to your lungs from the front, okay? Take a deep breath. And out. Again. Just go right here. Good. Okay, next I'm going to be assessing your heart and your circulation. So first I'm going to be feeling your chest for any lifts, heaves, or thrills. Okay, and now I'm going to be feeling for your PMI, so just lean forward. Okay, and now I'm just going to be listening to your chest. Okay, and I'm going to be doing the same with the bell. So now I'm going to be listening to your heart with you lying down. Okay, and now with the bell. Okay, now I'm going to ask for you to lie on your left side. Okay, that's good. Okay, and come on back. All right, now I'm going to check your pulses. Radial pulse. Radial pulse. Popliteal. Tibial. And dorsipedis. There is no edema or swelling in the lower extremities. Okay, now I'm going to be assessing your abdomen. First, I'm just going to look, make sure that those lumps, bumps, bruises, symmetric. Okay, now I'm going to listen. Okay, now I'm going to listen to your aorta, renal arteries, iliac arteries, and femoral arteries. Okay, now I'm going to be percussing or making some tapping motions on your belly, okay? Okay, now I'm going to measure your liver, so I'm going to tap again, okay? And a normal liver is 6 to 12 centimeters. Okay, next I'm going to feel for your aortic pulse. Okay, and the normal width of an aorta would be 4 centimeters. Okay, now I'm going to palpate your tummy. I'm going to push really light first, and then I'm going to go a little deeper the second time. Light palpation. Okay, and a little bit deeper. Let me know if you have any pain. Okay, now I'm going to feel for your liver, so take a deep breath. And out. And again. Now again on your spleen. Up. Again. Okay, now I'm going to feel for your kidneys. Again on this side. Good. Okay, next we are moving on to the musculoskeletal assessment. I'm going to be touching your arms and your legs, and then I'm going to be asking you to do some movements, okay? All right, so I'm going to tighten your arms, your joints and your muscles. Okay, so we're going to start with your neck, forward, and bend backward, look right, look left, tilt your head down to your shoulder, and down. Okay, now try to push your head to my hand, and again. and again, and again. Okay, good. Next, we're gonna move on to your shoulders. I'm gonna ask you to raise your arms out and down. Okay, now do the same thing, trying to push my hands up and put them down, push. Good. All right, so now we're gonna follow me. Arms up, swing all the way back. Good. All right, right over to your shoulder, left over to your shoulder. All right, now your right arm, you're gonna go behind your back and touch your shoulder blade. Left arm behind your back and touch your shoulder blade. All right, now go like this and push backwards. Good. Next, we're gonna move on to your elbows. So straight, bend up, bend down, put your hands to the ground and up to the ceiling. All right, now go back like this. Try to push my hands and pull. Good. Next, we're moving on to your wrists. Straight, up, down, out, in. Good. Now make a fist and push your hands and push down. Good. Next to your fingers, out, in, bend, straight. All right, now squeeze my fingers. Perfect. Now we're gonna move on to your hips. So lift up, and down, and up, and down, and sideways, and rotate over. And now the same thing on the other leg. Rotate over. Good. Now we're gonna do your knees. Straighten your legs all the way out, and bend them back down. All right. Now push my hands, and pull. Good. Now we're gonna do your feet. Point your toes, and flex them up. Now swing them out, and swing them in. Perfect. Now push my hands, and pull them up. Good. All right, so now I'm gonna have you stand up. All right, you're gonna swing your leg back. Move up if you need to. And swing your other leg back. And out to the side. And out to the other side. Perfect. Now can you touch your toes? All right, good. Stand up. All right, I'm gonna have you bend back a little bit. I'll support you. Good. All right, now if you can bend side to side. Perfect. All right, and I'm gonna support your hips. Just rotate the top of your body side to side. Great. Okay, for the last part of the assessment, we're going to be doing the neuro assessment. So I asked you 3 words in the beginning of the assessment to remember. Do you remember those?
3 green dog.
And I'm going to be asking you a judgment question. If you were out in public and saw someone who wasn't breathing, what would you do first?
Call 911.
Perfect. I'm going to be checking your reflexes. I would use a reflex hammer normally, but for the purpose of this video, I'm using my pen. All right. Bicep, tricep, and brachioradialis, patellar, Achilles, and Babinski. And check for clonus. All right. I will also be checking with a tuning fork the vibration on your big toe. I would be placing it at the distal interphalangeal joint. I would be asking you if you felt the vibration and when it stopped, and I would be repeating it on your other toe. All right, next I'm going to be checking for proprioception. So if you can close your eyes and tell me if your toe is going up or down.
Up, up, down, up, down, down, up, up.
Perfect. All right, next I'm going to be checking for sensation. So just tell me if you feel sharp or soft. Close your eyes, please.
Soft, soft, sharp, 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 soft, 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 sharp, 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 soft, 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 sharp.
Great. All right, so next I'm going to be placing an item in your hand. I'm going to have you close your eyes and put your hand out. All right, tell me what the item is.
A coin.
Yep. And keep your eyes closed, and I'm going to draw something in the palm of your hand, and you're going to tell me what I'm drawing.
3.
Perfect. Next, I'm going to be checking your coordination. So I'm going to have you touch your nose and then touch my finger, and we're going to be moving it around. Okay, next one. Okay, and then next, I'm going to also check your coordination again. Put your hand out, take your other hand, put it in there, and flip it back and forth. Okay, and then we're going to do it again on the other hand. Next, I'm going to be checking your balance, so if you can scoot up a little bit. All right, I'm going to just kind of push on you a little bit. All right, good. Next, I'm going to have you stand up, and we're going to check your balance once again. So I'm going to have you close your eyes. Okay, good. And now I'm going to have you hold both your hands out, palms up, and close your eyes again. Okay, good. All right, for the last part, we are going to take a little walk. So I'm going to have you walk from here to the cabinet, normal walk. Okay, good. On the way back, do heel, toe, heel, toe. Good. All right, on the way back, you're going to do walk just on your heels. All right, and on the way back, just on your tippy toes. All right, great. That concludes our assessment.